very good morning to all of our students. I am Dr. Umar Nazir, working as demonstrator in the Department of Community Medicine, Government Medical College, Srinagar. Today, I will be taking a session on concepts of control in diseases. Before starting today's session, as all of you know, the world is going through a period of crisis due to COVID 19. But whether we look at it as a crisis or an opportunity to reshape our thinking depends on us. So, use this period as a lesson on how to live life with a concern for all of the humanity in combating or controlling this disease. Learning objectives for today's session would be introduction to control in diseases, to know about the elimination of a disease, to know about the eradication of a disease, to know about the extinction of a disease, to know about monitoring and surveillance of a disease, and lastly, to know about the evaluation of controls. Now let's start with disease prevention and control. Every disease has certain weak points susceptible to attack. The basic approach in controlling disease is to identify these weak points and break the weakest links in the chain of transmission of disease. This requires sound epidemiological knowledge of the disease, that is, its magnitude, distribution in time, place and person, multifactorial causation, source of infection, and dynamics of disease transmission. When public health experts talk about controlling the disease, they mean reducing the number of new infections, the number of people currently infected, and the number of people who become sick or die from a disease in local settings. Public health experts develop policies, standards, and guidelines for the elimination of these diseases, develop plans, programs, and projects to carry out preventive and control strategies against elimination of all these diseases. The term disease control describes ongoing operations aimed at reducing the incidence of disease, the duration of disease, and consequently the risk of transmission of disease, the effects of infection, including both the physical, the psychosocial complications, the financial burden to the community. For controlling disease, community participation, political support, and intersectoral coordination is a must. Control measures should not be delayed because of incomplete or lack of accurate knowledge of the etiological agent. The classical example is that of John Snow controlling the epidemic in London by removing the handle of the incriminated water pump. The Black Plague was ended through the implementation of quarantines. The uninfected would typically remain in their homes and only leave when it was necessary, while those who could afford to do so would leave the more densely populated area and live in greater isolation. In Spanish flu, we largely implemented non pharmacological interventions such as isolation, quarantine, good personal hygiene, use of disinfectants, masks, and limit on public gathering, which were used in many cities that time also, and now in COVID-19 pandemic we also use the same things right now. Control activities focus on primary prevention or secondary prevention, but most programs combine both. Primary prevention can be defined as the action taken prior to the onset of disease, which removes the possibility that the disease will ever occur. It signifies interventions in the pre-pathogenesis phase of a disease or health problem. Primary prevention may be accomplished by measures of health promotion like altering the behavior of smokers in cigarette smoking and specific protection like we will introduce COVID-19 vaccine in providing protection in healthcare workers and frontline workers within couple of weeks. Secondary prevention takes action which halts the progress of a disease at its incipient stage and prevents complications. The specific interventions are early diagnosis, example screening tests and case finding programs, and secondly, after giving adequate treatment. Now about control, elimination, and eradication. Control public policy interventions that restrict the circulation of infection agent beyond the level that would result from spontaneous individual behaviors to protect against infection. Elimination means reduction to zero of the instance of specified disease in a defined geographic area as a result of deliberate efforts. Eradication, it means termination of all transmission of infection by extermination of infectious agent. Now about disease elimination. Between control and eradication, an intermediate goal has been described called regional elimination. Regional elimination means that the disease has been eliminated from some region. Now let's know what elimination really means in public health. The term elimination is used to describe interruption of transmission of disease or reduction of case transmission to a predetermined very low level or to a zero level. The instance of a specified disease in a defined geographic area with continued intervention is known as elimination. For example, measles, polio, diphtheria, leprosy has been eliminated from large geographical areas or regions. Regional elimination is now seen as an important precursor of eradication. Now about disease eradication. Eradication literally means to tear out by roots. It's a process of termination of all the transmission of infection by extermination of the infectious agent through surveillance and containment efforts. Eradication is an absolute process and all or none phenomenon restricted to termination of infection from the whole world. It implies that disease will no longer occur in a population. Selection of infectious diseases for eradication is based on rigorous criteria as both biological and technical features whether a pathogenic organism is eradicable. The criteria for eradication are: the targeted organism must not have a non-human reservoir. Sufficient information on the life cycle and transmission dynamics is available at the time of an eradication initiative is programmed. An efficient and practical intervention such as vaccine or antibiotic must be available to interrupt transmission of the infective agent. The disease to be eradicated should be clearly identifiable and an accurate diagnosis tool should exist. Disease should not be infective or communicable in its subclinical form. Economic considerations as well as societal and the political support and commitment are other crucial factors that determine eradication feasibility. Till now, we are only able to eradicate smallpox from this world, and hopefully, within some time, we will eradicate polio also from this world. Now, about extinction. Extinction is a status when specific infectious agent no longer exists in nature or in lab. So far, there is no such disease exist. Even after eradication, disease agent is kept in laboratory of Center for Disease Control for combating future threats of reemergence of disease. Like smallpox virus is still maintained in two laboratories, one in US and other in Russia. Smallpox Eradication Advisory Group recently has concluded that the risk of accidental release from these laboratories could not be reduced to zero. It's therefore recommended that smallpox surveillance be continued and that an international stockpile of smallpox vaccine be maintained. This was about what extinction means. Now let's talk about monitoring. Monitoring as well as evaluation are ongoing activities that help all the concerned people, especially policymakers and planners of the country, to know the status of health and related aspects. Monitoring and evaluation also helps to know whether activities planned are progressing as per desired direction and pace, and whether the strategies adopted and intervention carried out are effective to achieve desired results. Monitoring is usually done routinely, either monthly, quarterly, or yearly, while evaluation is carried out at specific interval of 3 to 5 years or more. Every country is having its own monitoring and evaluation system. In India, monitoring of health program is being carried out by a regular reporting system known as Management Information System, focusing on various process and output indicators as inbuilt part of healthcare delivery system. Monitoring is the performance and analysis of routine measurements aimed at detecting changes in the environment or health status of population. Thus, we have monitoring of air pollution, water quality, growth and nutrition status, blood pressure measurement in elderly population. It also refers to the ongoing measurement of performance of health service or a health professional, or of the extent to which patient comply with or adhere to advice from health professionals. Now about the surveillance in disease control. Surveillance means to watch over with great attention, authority, and often with suspicion. According to another author, surveillance is defined as the continuous scrutiny of the factors that determine the occurrence and distribution of disease and other conditions of ill health. Example: continuous monitoring of air pollution detected dangerous suspended particle matter levels during winter season in Delhi, and people were told protective measures to avoid respiratory disease. So, the purpose of surveillance is to detect change in trend or distribution in order to initiate investigation or control measures. Now about the objectives of a surveillance. The main objectives of surveillance are: number first, to provide information about new and changing trends in the health status of a population. Example, their morbidity, their mortality, nutritional status, or other indicators, and environmental hazards, health practices, and other factors that may affect health at the community level. Number second, to provide feedback which may be expected to modify the policy and the system itself and lead to redefinition of objectives, and also provide timely warning of public health disaster so that interventions can be mobilized. Now about the types of surveillance. They are active surveillance, passive surveillance, sentinel surveillance, behavioral surveillance, and nutritional surveillance. Active surveillance is used when there is an indication that something unusual is occurring or disease is highly contagious, fatal, or in the process of elimination or eradication. In this process, criteria are established for reporting disease, risk factors, or health events, but those maintaining the surveillance systems initiate reporting. Active surveillance presently conducted for polio cases and it's important till polio is eradicated. Other examples of active surveillance are domiciliary fortnight visits for malaria cases in National Vector-Borne Disease Control Program, Project Nikshay for active TB surveillance. Now about passive surveillance. In passive surveillance, criteria are established for reporting disease, risk factors, or health related events. Health practitioners are notified of the requirements and they report events as they come to their attention. This is more common type of surveillance. For example, a physician sees a patient, diagnoses, and then initiates a case report by contacting the local health department and providing the details as required for a case. Here, the local health administration relies on the physician to report the case. Number third, the Sentinel Surveillance. In this surveillance, we conduct unlinked anonymous testing of person for diseases under surveillance. This kind of surveillance is done either we suspect that there could be some missing cases or diseases has high level of social stigma. Example, HIV surveillance. Number fourth is the behavioral surveillance. It's a surveillance tool designed to track trends in HIV related knowledge, attitude, and behaviors in population at risk of HIV and sexually transmitted diseases. Behavior surveillance is defined as ongoing systemic collection, analysis, and interpretation of behavioral data relevant to understanding trends in the transmission of HIV and STIs. And lastly, the nutrition survey. In nutrition survey is an important tool for identifying existing system for collecting information on the current and future magnitude, distribution and causes of malnutrition in population, with emphasis on protein energy malnutrition in children. Initially, it was presumed that there are some diseases like anemia, rickets, osteoporosis, which occur due to nutritional disorders. But later it was noted that it includes wide range of morbidities like obesity, hypertension, cancers, coronary heart disease, and dental caries. Now, in this slide, we'll talk about the Sentinel surveillance. Sentinel surveillance is the monitoring of rate of occurrence of specific diseases, conditions through a voluntary network of doctors, laboratories, and public health departments with a view to assess the stability or change in health levels of a population. For example, we do HIV surveillance. Cases are reported from STD and ANC clinics and are tested for HIV infection. And these data help us to see the trend of infection at the country level. Now, before wrapping this session, let's know about the 4 C's in control of infectious diseases. These are cases, contacts, carriers, and community. Let's now take the example of COVID-19 pandemic in controlling the disease. Cases are defined people who are either symptomatic or are a suspected case of COVID-19. What we do with them? We put them for screening tests or for diagnostic tests in the form of rapid antigen test or RT-PCR. When the cases are diagnosed, they are notified to the government and simultaneously the patient is isolated for the disease if at home. His surrounding is disinfected at home and also put on treatment if the patient is having mild symptoms. He is to be followed up for another 14 days and is released only after when he turns negative and becomes symptom free after giving the concerned treatment. Contacts are the people who are very close to the patient and are put under observation. These contacts are put under quarantine at least for 14 days, and if amongst them anybody shows signs and symptoms of the disease, they are put for testing, and if turned positive, they are also labeled as cases. Now, about the third point in control of disease are the carriers. These are patients who are asymptomatic and has to be detected either by screening test or by rapid or by RT-PCR. For detection of these carriers, we had to carry out active surveillance in the field or in the area where we have more number of cases or there are clustering of cases. Lastly, what we have to do in the community, wherever there is clustering of cases, where the cases are more than 5, what we do, the area is put as containment zone, or nowadays we call them as micro containment zone in view of COVID-19 pandemic. In these areas, what we do, we start with contact tracing of the close contacts of the patient. After that, completing the contact tracing, what we do is we start active surveillance for the next 21 days in the area, so that most of the cases who are symptomatic should be diagnosed and put on treatment as soon as we get them. And simultaneously, the area is put in containment list. So before wrapping this session, we must all know what these 4 C's are. Now, before concluding today's session, let's know about evaluation of control in disease. Evaluation is the process by which results are compared with intended objectives, or more simply, the assessment of how well a program is performing. The purpose of evaluation is to improve the design and delivery of the program. Evaluation should always be considered during the planning and implementation stages of a program or activity. Evaluation may be crucial in identifying the health benefits derived, that's impact on the morbidity, mortality, sequelae, patient satisfaction. Evaluation can be useful in identifying performance difficulties. Evaluation studies may also be carried out to generate information for other purposes. For example, to attract attention to a problem, extension of control activities in diseases, training, and patient management. Evaluation is carried out after 3 to 5 years when the program is launched. With this, we wrap up today's session on disease control. Thank you.